Just a brief message for people that speak English. Below the picture, you can find a world, and if you click the icon of
En
the
la barra
world,
de herramientas podrán
you
encontrar un
can
globo terráqueo y
identify
si
the
hacen clic
translation, the
allí
continuous
podrán
translation.
identificar la traducción.
Hola.
Hello everyone, welcome. We are now going to start the webinar launching the course on evaluation strategies for the competency-based assessment course. Now we are going to ask the director of the department Family Health Promotion and Life Course, Dr. Andres de Francisco, to please take the floor in the webinar. Thank you. Thank you, Bremen. Good morning, dear colleagues. It's an honor for me to have this opportunity to open this meeting, launching this virtual course of competency-based assessment. The objective of this webinar is to give you the information for this course, on this course for the assessment. We decided to launch this very important course today precisely because, as you know, today it's International Day of the Midwives at a global level. And in that regard, I'd like to focus my words to pay tribute to thousands of midwives around the world who have died as they worked hard for the health of mothers and newborns, sometimes without even the proper equipment to protect themselves from SARS-CoV-2 in this very strong pandemic. In addition, I'd like to reflect upon some initiatives that should be implemented to improve the conditions of the midwives wherever they are working and whatever their cycle. This morning, they launched globally the 2021 edition on of the report on the current status of midwifery in Geneva. And the report highlights the current conditions, and it provides very interesting information because we see that midwives could be giving 90% of the reproductive, maternal, neonatal, and adolescent health. However, they are barely 10% or less than 10% of the global task force of the staff providing this healthcare. And this is another 1090 gap. In our region, in the Americas, the proportion of midwives is even lower than the global 10%. It's estimated in 8%. And that shows how we are far behind in terms of the human resources required. And the studies that were launched this morning show that the world needs 900,000 midwives more than the existing one. And this has no precedence because initially when they developed the SDGs, it was estimated that we needed 300,000, and after 30 years, this has multiplied ×3. And by 2030, we'll be held accountable to see what we've done with SDGs, and the shortage of midwives will continue to be huge. And in the countries where there are more midwives, maybe it's the countries that don't need them the worst. In 2019, according to World Bank data, we would have needed 6.5 billion hours of care globally for reproductive, maternal, neonatal, and adolescent health, while in our region, we were 0.7 billion hours short. It is estimated that this need will increase even further in future years. But midwives not just work on reproductive and maternal health, but they play a key role in the prevention of deaths of newborns. So competent and regulated midwives would help us save millions of lives or thousands of lives yearly. And this, they would also bring about other benefits such as increase family cohesion, increase economic stabilization, equitable growth, early child development, which is a very important action from the moment of birth. So this morning, they launched the slogan, "Follow the data. Invest in midwives." That's a slogan. And we, as PAHO, we continue to be committed using the evidence available to continue to strengthen their competencies, as well as to advocate among our partners and governments to dignify their profession, because as I said before, it is extremely important. So aligned with the 3 pillars of the International Confederation of Midwives, today we are launching this virtual course because we believe that it is very important to strengthen the competencies of midwives in terms of education. Thank you. Thank you, Dr. De Francisco. Now, Dr. Susan Sarruya, Director of the Latin American Center for Perinatology and Director of the Women's and Reproductive Health Unit of PAHO. Thank you, Bremen. Thank you, Andres, for your participation with us. I'm going to start sharing my screen. And first of all, I want to speak in the name of the Latin American Center for Perinatology. I want to welcome all of you. We are already quite a significant number of people at this meeting, which shows that everybody's interested in it. So today, debating what we have just heard, that is how to improve the competencies of midwives, is very important. And at present, we have over 440 participants. I see it now. And we expect many more to come because we want this virtual course on a competency-based assessment will help reduce maternal mortality. And what Andres, our director, has just said is what we want to show to you, because we know, and we've known it for a long time, that skilled care and having skilled healthcare workers is what will enable us to reduce the maternal mortality rates. And so we know that mortality rate is frankly reduced if we have skilled people. But we also know, or we also know that when we have care with midwife, with nurses, or parteras or matronas, as we call it in Spanish, and even if we have a low number of doctors, still we are going to have a low maternal mortality rate. So what has just been published at WHO is a very compelling evidence for today, when we are striving to reduce maternal mortality that unfortunately has gone up with COVID-19, so that we can honor our SDG commitments. So we're going to continue to work even with a greater commitment in the pillars established by the ICM. So to strengthen midwifery, PAHO has aligned itself in the 3 pillars described by ICM: education, regulation, and association. In terms of education, we we have been working with a number of partners highly focused on competency-based education. So there was a string of workshops that started at a regional level, and they were replicated at different levels, and more than 600 professionals have been trained. That is one of the strengths of a CLAP with its partners. So here we have our, for instance, UNFPA, GH Piego, USAID, CRMA, FLOW, among others. So in addition to those workshops to train on competency-based assessment, we work to evaluate these CBAs to see what we need to improve in the process, because it's a process. And we need to be all the time trying to see how we can have better professionals in the profession. We have all worked on regulation, a very important commitment of the Confederation in the countries to so that the right attributions may be recognized so that midwives may practice their jobs fully. We also worked to promote association, and we are close to FLOW and CRMA for whatever is necessary. During the pandemic, several times we conducted joint webinars where we showed evidence, and we committed ourselves in updating the information for such a special moment. The story of this document, that's a master document. This is the last one. The toolbox for the practice of professional midwifery. We had an edition before the WHO edition. Then WHO published it, and we aligned it, and we are the only region that has this toolkit that is updated and adapted to our countries. And I want to tell you that I know all the chapters, all the modules that, and all the other publications of the Latin American Center for Perinatology, CLAP, and PAHO. So we have a significant set of publications. So we're going to put the link in the chat so that you can find them more easily. And finally, I finish with the most iconic publications in the world of midwifery. That is our translation. The translation, PAHO was authorized to translate Varney's Professional Midwifery. It's a sort of Bible. And the other is we worked on the competency-based education and evaluation strategies. Here we have some pictures. Some of them are iconic. And here I want to start by thanking Bremen. Look at him in the first picture, less than 10 years ago. He was very young. In the second, he looks older. He looks more like a professor. And here we have another very dear collaborator, Claudio de Sousa. Bremen, Claudio, and other colleagues of CLAP have devoted all their lives to these workshops, and now we're going to have it virtual. But before I finish, I want to tell you how CLAP sees the work of midwives. Beyond whatever we may see that is stated by WHO, we agree that we have to invest strongly in midwives, in caregivers that are close to the woman. And we know at CLAP, we are aware of your commitment with the organization. I always say that childbirth is one of the most transcendental moments in the life of a woman and that of a family, not just a woman, but the entire family. And we know that the local care brings a result in this feeling of belonging, and it needs to be humanized. And the midwives play a key role. That is why we wanted to tell you that this course was designed to expand this very important role, the role you play. I think that most of the people in the audience are midwives, and CLAP wishes to thank that huge commitment that you have, not just in reducing maternal mortality, but also providing the solidarity that the women need at that time, and humanization of childbirth. And here I'm going to give you a spoiler, and I'd like to tell you that in July we are also going to launch virtually, because of the pandemic, we're going to launch another course on the respectful maternal treatment or management. And we know that you're going to be very happy to receive it, because we are aware of your commitment being by the woman's side in their communities, in each of those sites. And we believe that we don't want the midwives to be only there, but at all levels of care, from the most simple job to the highest, because we know of how important it is to have their contribution for the sake of women's and newborns' health. So thank you. I welcome you all, and now Bremen is going to present the agenda, and I'm sure that all of you will be very happy to participate in this very important meeting. So CLAP wants to thank all of you. Thank you, Bremen. Now, rather the contrary, we thank you, Suzanne. Now, we are going to switch gears at the meeting, because I think it's the most relevant. We talked, Paho talked, but now we're going to listen to professional midwives, male and female midwives. And precisely one of the pictures that Suzanne was showing a few seconds ago, we saw the previous representatives of ICM for Latin America of recent years, Miriam Solis of Peru and Sandra Yarzo from Chile, who's now the vice president of ICM. So we have to congratulate that we have a vice president in the region. But also, I wanted to tell you that now the next speaker who will discuss the current situation of midwifery is the new representative of ICM for Latin America, that is Maria Florencia Francisconi from Argentina, a very young midwife with a great drive, and who's helping us and participating from Portugal. So Florencia, please. Hello, everybody. Good afternoon. Let me share the screen. Well, can you hear me well? Yes, perfect. Thank you. Well, good afternoon, everyone. Thank you for the invitation. Thank you for considering that the International Confederation of Midwives needed to be present and to be part of this launch. And I also want to wish a happy day to the 1.9 million colleagues that work in such a noble profession across the world. So, Bremen already presented me. I'm Maria Florencia Francisconi. I'm the Latin American representative of ICM for this triennium 2020-2023, and I'm going to tell you a bit about the situation of professional midwifery at a global level and in Latin America. Before I start, well, we all know what the International Confederation of Midwives is, but I'm going to give you some figures about the Confederation. It's an NGO that supports, represents, and works to strengthen the associations of professional midwives and the professional midwives. We know that in Latin America, we have different terms, obstetric nurses, midwives, etc. We represent more than 1 million midwives, 143 associations, and 124 countries divided into 6 regions, and particularly America, the region of the Americas, at least by 2023, we'll have 2 representatives, Latin America and the United States and Canada. Our colleague Pandora. So you've been discussing the key pillars of professional midwifery. From the Confederation, we created framework documents, definitions, documents related to a policy and practice of professional midwifery, etc. And we see how our 3 pillars have evolved. Bremen and Suzanne mentioned it: education, regulation, and association. And now we are also including research and the essential competencies in midwifery. In terms of the core competencies, well, this is the poster for presentation. You can find further information at our website of ICM. They were updated recently. The last review was in 2018. They were published in 2019. And basically, it has 4 spheres. One is general competencies. One is the antenatal care, the care during childbirth, and the continuing care of women and newborns. And this is a new professional framework where we see again that the core of this framework is research and the competencies that I just mentioned. We have education, regulation, association, leadership, midwifery philosophy, and also the continuity of care model of practice. All this under a big umbrella, so to speak, where we need an enabling environment to develop these activities and also to promote gender equality. So this is what some of the speakers mentioned so far. So this is the best way to celebrate our day, with the launching of a scientific activity and reinforce one of the key pillars of our professional framework. So now, having given this mini introduction, professional midwifery at an international level, ICM is proud to be able to celebrate this day under the slogan, "Data speak by themselves," investing, or look at the data, invest in midwifery. So our international day takes place at the same time as the launching of the report on the situation of midwifery in the world for 2021, the SOMI 2021. It's a sort of Bible for us, because it's an updated analysis of the impact that we have and our activities have on the good outcomes that we have on the maternal and neonatal health, in addition to the profitability of investing in midwifery. Let me share some data. Now, this is the version of SWOMI can already be downloaded. Midwives are key to achieve the ambitious SDGs and the provision of essential quality of care. We know that midwives can give complete packets on sexual and reproductive health to women, adolescents, and their families, and we play a key role in saving lives of women and newborns. Here we have, in terms of coverage, if we achieved a universal coverage of interventions by midwives, we would be able to save 4.3 million of lives annually by 2035. That is, we would be able to save 41% of maternal deaths, 39% of neonatal deaths, and 26% of stillbirths. Now, that is if we could increase 25% of the coverage. So, well, if we could, that would be if we could only increase it by 25%. And even being more moderate, if we could increase coverage by 10%, we would be saving 1.3 million lives annually by 2035. So the evidence is very clear, so slogans says, and the data has a huge importance, but investing in midwives not only saves lives, but it also improves the quality of health and the quality of services provided to the youth, to the clients. And at present, we are experiencing a global shortage of 900,000 midwives. And not a minor issue is that of those of us who are already practicing this profession, we experience substantial barriers that hinder the development of our full potential. Well, today we are celebrating, but still we have to remember these drawbacks. So to close the gap for 2030, we need 1.3 million of new workers on sexual, reproductive, maternal, neonatal, child and adolescent health in the next 10 years. But the shortage of midwives should not be covered with other professions. And this is something that Vistomi says, and it's also something supported in the previous report. So if you see the definition of midwives and midwifery of ICM, we have essential competencies and we have an area of work, and being able to invest in midwives and putting them to help in the care that would free doctors and nurses that could be in charge of other areas of healthcare. So although we need 1.3 million to cover of healthcare professionals, of that 1.3, 900,000 should be midwives, and they should not be substituted. There's an example when I was working on primary healthcare in the province of Buenos Aires. To cover these needs on sexual and reproductive health, there was one obstetrician and a gynecologist, and this speaks of how the healthcare workers are distributed within the system. A gynecologist is a medical expert that has devoted at least 10 years of his or her life to get the degree. That's a medical and surgical specialty. And they were, so although we as midwives need to be at all levels of care, there's a level of care that should be ours by excellence, that is primary care. And it should not be replaced. The rhythm of progress of the creation of healthcare workers in the field of sexual, reproductive, maternal, neonatal, child and adolescent health is not improving. And as a result, the gap between the high-income countries and the low-income countries will further increase. And this is not just a matter of life or death, but midwives can, and as a matter of fact, they do improve the quality of care and the health of the population. Professional midwives could deliver up to 90% of the essential care of sexual, reproductive, maternal, neonatal, child, and adolescent health throughout the life. But as Dr. De Francisco said, we represent less than 10% of the global healthcare workers in this area. So we have to invest in midwives, and that would have positive results with healthier families, more productive communities, and with stronger healthcare systems. Invested in midwifery should include not just in numbers, but also in education, continuing education, regulation, and the working environment. SOMI says that only 4 out of 73 countries report that they have the staff that is adequate to effectively respond to the needs of women and newborns. As we stayed in Argentina that we needed it for a day before yesterday, but well, at least we should have it today. The good news is that the benefit of having adequate healthcare staff exceeds the cost and has better yields. And finally, in terms of leaderships, 11% of the countries surveyed reported having no midwives in positions of leadership. Almost half reported that there were no midwives in the Ministry of Health, and in Europe, only 15% of the countries have leaderships of midwives at a national level. And in terms of human rights, by definition, we fight hand in hand for women and the rights of women and the children, but very often is to the expense of our own rights, because too frequently we are deprived of rest, self-care, work, and decent salaries and protection. And the pandemic has shown this. Now, speaking of Latin America, what happens in the region reflects what happens at an international level. Although I'm going to give you a general overview of Latin America, I want to remind you that the ICM has as member associations Argentina, Chile, Paraguay, Brazil, Uruguay, Costa Rica, Ecuador, Peru, and Mexico. And some of our challenges. I like this circle because we see that all the factors are intertwined. So if we improved recognition or regulation, that would have impact on autonomy and leadership, etc. And as to the recognition or the lack thereof, that has worsened during the pandemic. And there you see the picture of that the sexual health, sexual and reproductive rights of women has worsened during the pandemic. And precisely, among other things, this is a warning to express that we are first-line professionals, and as such, we need, for instance, something as elementary as the PPEs. So this lack of recognition is also shown because of the low salaries, retention, irregular contracts, and lack of training, in-service training. The regulation that has always been and will continue to be a permanent challenge, not just to maintain what we have already obtained. For instance, in Peru, until a few days ago, they fought for what they obtained with their act, but they are fighting so they won't lose it, and to get an adequate regulation. There are many countries that haven't obtained it consistent with our competencies, and to get autonomy. For instance, not depending on nurses. I know that this might be controversial, but what we aspire to have direct entry promotion. And we want to have clear laws of and regulations, incorporation at all levels of care. And I show this image. This is a communique by the colleagues in Brazil, supported by the Confederation. It was a warning about maternal deaths, and they claimed that the midwives had to be incorporated at all levels of care, and so as to provide women quality care even during the current pandemic. So incorporation at all levels of care, obviously, as we said, that everything is related with everything. We need a consistent regulation enabling an autonomous work that must be duly recognized and aligned to international competencies and standards. For instance, those that are supported by the Confederation. Gender equality. 93% of the midwives are women, but as a result of gender standards that are harmful and old-fashioned, midwifery and the role of taking care of women and newborns is undervalued. And this is in all society, and this is also has an impact on leadership, and our voices are excluded or ignored in decision making, and this causes great differences in genders in terms of remuneration and leadership, and so this has an impact on the development of the professional career, the wages. I know that in Uruguay they are fighting for their wages, and leadership. In order to advance in gender equality in the health area, we need more midwives in positions of leadership. In Latin America, we only have 2 midwives with positions of leadership in the Ministry of Health. I'm going to say their names because there are only 2, but we are very proud of them. In Chile, Georgia Cartes, who's the National Director of Midwifery, and in Paraguay, that has had this position for many years. At present, Sandra Recalde is the National Director of Obstetrics. And in terms of leadership, well, the Confederation has a program for training young leader midwives, because the young midwifery leaders, this is something that the Confederation is pushing forward. And research, research is part of one of our pillars that has evolved, and research is one of the key ones. We need to be able to have the possibility to reach our maximal professional scientific development, and we must produce the scientific evidence and show the positive outcomes that are obtained through investing in professional midwives. This is essential, and it's part of our strategic guidelines. And wrapping up, I don't know the time, but I'm sure that it's rather late. Our opportunities are, one of our strengths is to work in block. We are very united. There's a lot of communication among us. We have the support of our strategic partners to reinforce our actions. We have strategic guidelines, new strategic guidelines that help us align ourselves to international standards. 3. One is to promote innovation and sustainability for the future of professional midwifery. Another is develop, reinforce, and support the creation of a new professional framework for midwifery. And a third, to promote a movement of midwives that may permit and reinforce associations, the promotions that make the women's voice be heard. COVID-19 has revealed the importance of investing in primary care, and we have supported the voices for the claiming that we should work in the first line, as we've always done. We also have a new Communication and Advocacy Strategy. That's a regional newsletter. The second issue. And as the visibilization strategy is to extend the International Day of the Midwives for 10 years instead of 1, so as to complete it by the time that we complete the SDGs 2030. So thank you. I want to thank you again for your invitation, for considering the Confederation, and I wish our colleagues a wonderful day. Thank you, Flor. We are the ones who thank you. I'm going to request Dr. Lorena Binfa, while I present her, to share her screen. Professor Lorena Binfa is the director of the FAHO and WHO Collaborating Center in Midwifery, the only center in Latin America and Spanish-speaking world for the strengthening of midwifery. It's always a pleasure to work with her. And perfect. And while she shares her screen, let me give a message for the English speakers who have not been able to
just a little reminder for English speakers. To hear the simultaneous translation into English, please click on the word icon located at the bottom right to obtain the translation into English. Thank you. Adelante, Lorena.
Muchas gracias, Dr. De Musso.
Thank you, Dr. De Musso. Have a good day, all midwives in the world, particularly those who belong to our region. Briefly, I must confess what I believe is the importance of training human resources in midwifery, and particularly the launch of this virtual online course on competency-based evaluation together with CLAP, and the history of this course. Why is this so important? Well, a lot has already been said, but in general terms, we all are aware of the great contribution made by midwifery care, contributing to the development of high quality services for mother and child care services. Furthermore, the introduction of midwifery and obstetrics competent professionals qualified according to international standards may provide, as has been mentioned, close to 90% of primary care for women and newborns, including family planning. This is why the role of midwives is so important at the primary level of care. More than 80% of all maternal deaths, fetal deaths, and neonatal deaths could be prevented, and this is extremely important, an improvement in the quality of care. In order to achieve this, the quality of training is critical in order to reach this quality care, and so that the midwife is qualified to practice her professional task in a complete manner. Our region, according to the classification, is occurring in countries at the third level with high maternal mortality, variable fertility rate, and predominance of the causes of mortality, where access to care is an issue and the quality of care is one of the greatest determinants of the health outcomes. And other countries at the fourth level, where maternal mortality is moderate to low, there's low fertility and a predominance of indirect causes of maternal mortality, particularly chronic non-communicable diseases, where further reducing maternal mortality means necessarily improving the quality of care. And we highlight in these countries in the fourth level, over-medicalization as an emerging issue and a significant threat in quality and improvement of health outcomes. Latin America is a rather heterogeneous region at all levels and has the greatest inequity, and this is a major challenge. We have already heard that model-based studies report the benefit of investing in training midwives, and Flor has already said that when increasing coverage of interventions conducted by these professionals, the health systems could provide effective coverage of essential interventions in sexual and reproductive health, maternal, neonatal, and adolescent health at a scale that cannot be compared with other health interventions. And as we also heard, reaching universal coverage, if we were to reach it, we might reduce 67% of maternal deaths, 64% of neonatal deaths, and 65% of fetal deaths. In 88 countries of low and middle income that represent the greatest part of these figures. And less ambitious coverage also would signify a significant reduction of avoidable deaths. However, in order to reach this potential, these professionals should have the necessary competencies and training in agreement with international standards as established by ICM, be part of a competent health team with a sufficient number of members, and work in an appropriate health context. In order to achieve obstetric and midwife quality care, we urgently need excellency in education and training, including training material based on evidence and updated. Evidence has identified that if we meet these requirements, it is possible to improve 56 outcomes when we achieve the complete obstetric practice. That is, these educated or trained midwives reach international standards. For this reason, this work or paper published in Lancet generates this conceptual framework for the quality of maternal and neonatal care, taking into account as essential components a set of effective practices, how this care is organized, the rationale and values of the health team working in this field, and its different characteristics, and indicates a set of clinical practices for all mothers and newborns regarding education, information, healthcare promotion, planning of care, assessment, screening, promotion of the normal process and prevention of complications, and for mothers and newborns with complications to have a first line of complications, because the rest are medical obstetrician and neonatal care. How to organize this healthcare with accessible departments available with good quality of human resources trained for this, to provide this care. Values, respect, communication, knowledge of the community we're working with, understanding the rationale, of course, supporting in the best way possible physiological, psychological, social, and cultural processes the woman is experiencing, strengthening her capacities. And for health providers, that is our team, it is necessary to have professionals combining knowledge and clinical skills with interpersonal and cultural competencies, of course, teamwork and distribution of roles and responsibilities based on need, competencies, and resources. And this stresses clearly the urgent need of a transforming approach of education to guarantee midwives and other staff providing midwife care support the capacities of women themselves, in turn using critical thought and decision-making to prevent unnecessary interventions and at the same time appropriately respond to emergencies when these arise. This, of course, is accepted in 2015, where WHO shared the vision, anticipating that in the world, every pregnant women and newborns should receive quality care throughout pregnancy, delivery, and postnatal care, and establishes a framework of reference based on two dimensions that are equally important: provision of care and the experience in care, indicating that the quality of care is only possible when both dimensions are effectively accomplished. For this reason, not only to provide care that is efficient and with good quality, we need evidence-based practices, both in the routine practices and to prevent complications. The information system that can be processed and functional reference systems, but as important as this, we have the experience of care as perceived by the user based on effective communication, respect, and dignity, counting with emotional support. For this, we need competent and motivated human resources and also physical resources, it's essential physical resources available. This care must be safe, meaning providing health care, reducing to a minimum risks and harm to the users, including preventing all the harm that may be avoided and reducing medical error. Effective, providing scientifically based services and protocols and guidelines that are evidence-based. Timely, reducing delays in provision and reception of healthcare. Efficient, providing healthcare to maximize the use of resources and prevent losses. Equitable, healthcare shouldn't vary in quality according to personal characteristics such as gender, race, ethnic origin, geographic location, or social and economic status. And last, and extremely important, centered on individuals. The care provided must bear in mind the preferences and aspirations of our clients at individual services and the culture in their communities. What do women expect from care during the reproductive process? A meta-analysis conducted in the study mentioned and published in Lancet found that at world level, women wish respectful treatment and competent care. They appreciate good communications, updated quality information, to have this sense of being in control, being enabled to participate in their care and decide different options. They expect relationships based on trust on those providing care that must be sensitive to their personal and cultural needs. And although many professionals indicate the use of evidence-based practices, and although systematic reviews are available, traditional practices are still prevalent. It is extremely important to respect keeping the mother and the baby together, the privacy and confidentiality, effectively counting with a chosen person to accompany, to choose a position for delivery, freedom of movement during delivery, and provide information and ensure informed consent. This is what women mostly expect and wish from the health team. In order to achieve this quality care with the characteristics as detailed, the evidence also indicates that there are two critical points: how to provide this respectful care and how to reduce this excess medicalization that is an emerging issue, particularly in our region. Both aspects require a significant investment. Competency-based education that requires many resources because it's based on repetition, reinforcement and development of new techniques and methodologies. And midwifery training should consider how to build on continuity and theoretical and clinical integration between pre-graduate training and the professional exercise later, and the need to invest on interprofessional education. And thus, in 2010, we had this independent commission published in Lancet with changes in training since the 1900s to date, from a science-based model at institutional level to a very different syllabus at scientific level based on universities, advancing towards a problem-solving
and that is why we should have medical centers, and that what we need today is a system-based training where we may have, that may be granted by the universities and the healthcare centers. Education can only be achieved through the interaction of these two systems. And that is how in 2019, the member states launched at the World Health Assembly the joint framework of action between WHO, UNFPA, UNICEF, and ICM to strengthen the education of quality midwifery to really achieve the universal health coverage. And this establishes the most recent global evidence as well as a consensus for action and a plan of action with 7 steps for an education on quality midwifery. The first is to strengthen leadership and policy. The second step is gather data to support evidence. And the second is to build public engagement and advocacy. The fourth is to prepare educational institutions, practice settings, and clinical mentors. The fifth is to strengthen faculty standards and curricula. The sixth is to educate students. And the seventh is to supervise, evaluate, review, and adjust. The course that we are going to present contributes to the 4th, 5th, and 7th step of the steps that we mentioned to strengthen a quality midwifery education. Recently, the recent report on the state of the world's midwifery already is indicating the need to invest in high quality education and high quality training for midwives. It points out that as an average, only 65% of the midwifery trainers are midwives themselves. So there's a call for action to invest in more faculty that are midwives. And there's a difference among the countries in terms of the quality of education and training, and it establishes 3 strategic priorities for midwife education. Obviously, all midwives need to be educated to high standards and enabled to practice to their full scope of their profession. Hopefully, too, there should be midwives involved in education policy at the highest level. And finally, the third would be the coordination and alignment of education processes. So I think that in that respect, the whole club had a great vision where they were visionaries creating these courses, particularly the one that we're going to discuss today, because it's a way to deliver a tool that is available to midwifery professionals, absolutely updated and competency-based. That is what we believe that needs to be done to provide high quality training. So they showed their vision, and because the numbers are quite eloquent, because and the online modality, the virtual modality of this course, even not knowing that the pandemic was coming, thanks to that, we now have a virtual course that is available to professional midwives anywhere in the world and at the time of the day that they can receive that training. So I thank you again for giving us this opportunity for creating this course and celebrating this International Day of Midwives, and to wrap up with this very important message. A character, Albert Einstein, said, you should never consider study as an obligation, but as an opportunity to penetrate the beautiful and wonderful world of knowing. Wishing is being able to do things. So I hope, and I'm sure that midwives will accept this challenge with a quality education that may help us meet these objectives. Thank you. Thank you, Lorena. Thanks a lot. After these presentations, and especially after Floor's presentation, who showed us a general overview of what's going on with midwifery in the region and around the world, now Lorena more specifically discussed a topic that has to do with education. And she especially pointed out the need in this region, and the same thing happens all around the world, is to have more qualified midwifery faculty. And now, having finished these two presentations, we'll delve more specifically into some of the contents of the course. So please, Professor Pablo Galvez, the Deputy Director of the School of Obstetrics of the University of Chile, to please share his screen. He's going to talk about the grounds and the tools of these strategies of this competency-based education that has been used in this virtual course. Before Pablo starts his talk, both Pablo, Lorena, and Marisa, yes, Marisa, who will be the next speaker, or Maribel Mela, who is not speaking, but and other colleagues of the University of Chile, they are the creators of this course. In addition, you'll see some presentations that have some things in particular and some details that are part of a kit that we'll share in a few minutes that was done by the developers of this course, whom we are extremely grateful. A company in Argentina and the United States that is called Tercer Término. It's an e-learning company that has given us a huge support for this course. So Pablo, without further ado, please, the floor is yours. Hello, good afternoon, or good morning, wherever you are. Thank you, Dr. De Murcio. I'm going to tell you a bit what this course is all about. We prepared it with a group of midwives of Chile, University of Chile. And today, fortunately, some of us that developed this course are present. And in a short period of time, hopefully, we'll present what it is, what are the modules that we'll be able to present, and you're going to be able to start working with them. We are very happy to work with Tercer Término, this company that helped us develop this very interesting product. So let me tell you initially that, well, you can enter the platform if you are using a computer or a laptop, www.menti.com, and you enter this code for this presentation to be more interactive. If you are using a mobile phone or a tablet, you can scan this QR code to send your answers to make this more interactive. While you do that, well, you wait 30 seconds for that. And so this is a course that originated several years ago as a request of our center that collaborates with the University of Chile. And thanks to PAHO and the WHO, we could have in-person courses in Chile and abroad to train midwives and strengthen their competencies, especially the competency-based assessment for midwife professionals. I'm now going to switch. Let me see how many people are connected already. Remember, while you log in, you can enter www.menti.com and use that code to answer this question. So the first thing that we want to know is, what is competency-based assessment? Can you describe it in one word? What do you understand by that? So write your answer down. Can you hear me? He's asking. At any rate, we'll continue to use this presentation by Menti, so you can continue to register, and I'm going to move forward so that you may work with the second part of this presentation. Pablo, please, sorry for the app says that this question is not yet open for voting. So some colleagues are telling us that in the chat. If you think that this will make it complicated, just go ahead with your presentation. Don't worry about it. Well, in the meantime, let's fix this Menti thing. Let me tell you what this course is all about. We prepared it for you and for the midwifery colleagues. There are 3 modules, starting from the very basic and the competency-based assessment, with 4 units that take us from the competency assessment to the key methods that are used for evaluation in this type of system. Then we see these instruments, especially those that are used for competency-based assessment. And then we'll see how to implement the structured objective, the clinical examination, to assess the competencies. And the training has several key objectives. The first is to analyze theoretical foundations of the competency-based evaluations as a key element for the teaching and learning processes, engaging all the stakeholders, that is, mostly the teachers and students, and also to identify and describe the key tools mentioned in literature for competency-based assessments. Also to understand the contributions and benefits of this clinical objective structured clinical examination and the evaluation of the clinical competencies and proper use of these skills. So I'm going to present module 1 that we call the core concepts of the competency-based assessment. We have 4 units that end up with a theoretical assessment of the aspects that we saw. So we start seeing how we the concept of assessment, how we can work it out, to see the achievements and how we can make objective the learning goals, and how we then we go on with unit 2, that is the significant learning. We're going to see what it means to acquire or to have a significant learning, and how this, together with rationality and emotions, make that learning persist in time. And the use for midwives. In unit 3, we'll see the authentic assessment.
How we can assess the aspects we wanted to work in a course at cognitive level, family level, attitudes and others. And last, have assessments from different standpoints, from the trainer, but also among peers, to add on in the assessment. And last, the introduction to the methods that will allow us to assess competencies expressed in achievements and learning and outcomes. Just briefly, let's look to see if the Mentimeter worked for the second question. Well, here we have the second question. Let's wait a couple of seconds to see if it works. If not, I will continue. You can write again in the app what tools allow us to assess competencies in our students. Once again, when you enter, you will be able to place a few words. We already have 3 participants already who have mentioned the use of OSCE to assess competencies of midwives and healthcare students. There are different surveys. They use simulations as well, acquired skills tests, face-to-face or online clinical cases, portfolios, rubrics, OSCE, continuous training and education for teachers and students. Once again, we have drills. This is very positive because it increases cognitive learning to acquire skills prior to clinical practice or even within clinical practice. Drills, rubrics. Well, it's good to have these lists to compare drills, OSCEs, tests, surveys, and so on. Thank you for those who participated. Let's continue using the Mentimeter in the next presentation so that you can place your ideas or let us know about your experiences. We have problem-based analysis, simulation, or models, anatomical models. Thank you so much. Let's go back then to my presentation to end on time. As then you yourselves mentioned in this interactive part we had, I will now share the second module where we worked on the tools for competency-based evaluation. The instruments we saw in the evidence and the experience we have had for over 15 years with a syllabus based on competencies. We used the ones listed here, multiple choice questions, rubrics, and others, where we will work on each of these issues in detail. Let's learn then how to easily build a good multiple choice question. What are the main mistakes we make when we create them? And what we've seen in our learning experiences, how to measure the quality of multiple choice questions. And this is one of the main tools used to measure, to gauge the acquisition of achievements and competencies in the health area. We'll see what a rubric is in detail, how to create one, and also technical key aspects to provide a high quality product, allowing us to really measure what we want to measure. That is a valid product to generate the results. We will also see what portfolios are. We mentioned face-to-face or printed portfolios. Many of you have worked on these, and e-portfolios that are those where we can record our experiences digitally and share our thoughts and guidelines to take into account how to work well together with them all. We'll also see what is team-based learning. We have many papers related to the fact of working in small groups or teams, encouraging a significant learning through an authentic assessment. We wanted also how to use team-based learning, TBL, to assess a competency-based curriculum. And then the definition of checklists. These checklists allow us to compare and tick the acquisition of certain skills at cognitive level, or what is more used and demonstrated by the evidence, skill acquisition, clinical and drills, and in real clinical experience when working with patients. I want to thank the people who invited us to speak. I hope I've been clear as the first two speakers, and I will now hand the floor to Marisa, who will continue speaking about other issues. Thank you. Thank you, Pablo. While Professor Marisa Villagrán places her presentation, I will highlight something you said that is related with something showed by Suzanne today. One of the books written in English that is part of the contents of this course for trainers, stating that although we will have this online course, this practically will not cover all the needs of those who are working, so that in CLAP we will continue providing support to countries that wish to continue working to build on these capacities when we return to the old normality, in order to have small groups and scenarios, particularly with teacher training, with face-to-face courses, as we had begun to validate a couple of years ago. Right now, then, without further ado, I will introduce Professor Marisa Villagrán, who is working at the Clinical Simulation Unit of Gyneco-Obstetrics and Neonatal Care at Chile University. Welcome, Marisa. We are willing to listen to you now. Thank you, Dr. Mucio. Good morning, good afternoon to all those sharing this event. I'm very pleased to be sharing all this with you when celebrating our day. I will then continue with Pablo's presentation on the course we've developed during some years in this online format now. Let's now consider some items of the third module. Particularly, we will focus on the third module. We have seen the basis for EBC. We saw the instruments for evaluation. Now we will focus on the objective structured clinical examination, OSCE. I now invite you to scan this code or enter into the www.menti.com page so we can have an interactive activity and then continue reviewing some elements we believe are relevant in our course and very significant, in particular for training midwives. Here you will see this image that says, what does this refer? Team training, drills. Let's give some time so that you share with us your views regarding this image. Individual work, OSCE, individuality, training, drills, OSCE, clinical practice, women in teams, drills, waiting, workshops, training workshops. Okay, this image we want to share is one of the images that is quite iconic for us in relation to a structured clinical examination. Clinical drills, clinical practice, yes. And in this examination, the basic idea is being able to conduct assessments and training activities, not only to add on in a context of pre-graduate and postgraduate training and training in specific professional skills also. Excuse me, Marisa, we can't see the slides you were showing. We have the image of the Menti activity. Okay, let me continue then. I read several of the ideas you have shared. As for the image we had in the Menti, and now let us focus on this image as OSCE, where students are facing the different stations. And let us now define OSCE as an examination framework to assess professional competencies, allowing us to incorporate different sorts of instruments for evaluation in successive evaluations, aiming at real clinical situations with patient safety, where students will train in these clinical situations in simulation contexts. It's important to highlight that OSCE is a validated evaluation instrument that is reliable and will allow us to measure multiple skills in different contexts. This requires a very precise construction, being clear about the objectives I wish to measure, what I wish to assess, and why, in what part of the training process we are with students. And all these elements then will be included in the course in order to be analyzed. Within competency training, we will include different levels of training. So we need different levels of assessment. There's a basic core that it regards knowing things and management of theoretical contents. And here probably tests and other written tests will be important. And then we have a procedural core, knowing how to do things. And this is a strategic element where we will begin to assess how things are done in the clinical context. So at this first level, where we wish to be aware of the specific knowledge on a subject of students, we will be able to generate or assess the baseline in the learning process of the trainee. Then, at a second level, we want to know how they apply these contents, this theoretical knowledge. And at a third level, we want them to demonstrate how they apply this knowledge. And here, Bremen, it's very important to consider the clinical context and the clinical drills or simulations to reach a final and fourth level where students will be able to act autonomously, reach their decisions, not only demonstrating theoretical knowledge, but strengthening this through experience. And this is generally related to the last level of training, but it's a competency assessment for professionals. So that is the doing, the last element. OSCE is a very significant element in the third and fourth levels of training that are more complex. It is important to have as a basis, and in the Menti, you mentioned several individuals mentioned clinical drills or simulations. And in this OSCE, as a tool, we will need a series of knowledge related to clinical drills that allow us to observe skills in diagnosis, decision-making regarding therapeutic models, for example, within the real context. This provides a possibility of observing the skills of students in effective communication, the capacity to work as a team, and training as a team, and assess skills in terms of ethical behavior and procedure.
As I already mentioned, it's important to use it in training and summative context, both undergraduate and postgraduate settings. A brief comment on the history of a simulation in midwifery. I was trying to learn more of the history for this course, and we found that in the 18th century, the midwives practiced with no formal training, and at that time there was a significant increase of maternal deaths. So historically, it's reported that Louis XV in France contacted Madame de Coudray, who was a midwife who had received formal training, and asked her to go all about France to teach women about the art of delivery. And it was already in the year 1700 that this midwife built, using the pelvis of a woman, built this structure that was known as the machine. And with these elements and all these dolls made with material used at the time, she went through different places and taught how to practice deliveries. That was a very clever strategy at the time, because most of the women that they were going to train were illiterate. So clearly, this was a very useful tool to enable training under those circumstances. The results at the time are that, well, she visited at least 40 cities and villages between 1760 and 1783, and she trained more than 4,000 women, and she also trained 500 midwives and surgeons on delivery. And history also reports that as she went from one village to the other, the mortality rates during delivery went down. So as a result of this, in the 18th century, the population in France went from 20 to 27 million because the number of deaths and the expectancy of survival of the newborns also increased. So in this course, what we are aiming is to help the students select the evaluation method and to create the working teams, how we build tools for the clinical examination, the structured, objective clinical examination, the specifications tables, the circuits, the resource matrix, and the how to conduct these exams. The objective of all this material and all this course that we have designed with a great love and also with great dedication is that we hope we can strengthen the education and training of nurses and to have a positive impact in the care of mothers and the children and their families. So this is what I wanted to tell you about. And in this course, in this structured, objective clinical examination, you'll find the different stages. And we're also going to see it in a material that we're going to share right now. That is what I had to say, Dr. De Mucio. Thank you, Marisa. Well, it's already rather late. We promise to those of you who can stay, it's only going to take 5 more minutes to tell you 3 important things. In just a few seconds, we're going to show a trailer of the course, and then the English course and the links that Ana Artigas, our communicator, is inviting you to, will be sharing the course. The English course, you can also already enter starting tomorrow, and the Spanish course is being loaded, so maybe early next week it will be available. So if you go enter through the virtual campus of PAHO, you can get in touch with us and we'll guide you there. But remember that starting tomorrow, it will be the course will be available in English, and starting next week, it's going to be available in Spanish too. So now we're going to show you the brief trailer, and my boss, Susana Sarrulla, will wrap up. Unfortunately, we don't have time to answer the questions in the chat, but if you send them by mail, we'll be very happy to answer them. Thank you for being with us.
¿Sabes lo que significa evaluar? Evaluar significa estimar, ponderar y calcular el valor de algo. Pero, ¿qué significa evaluar los conocimientos, habilidades y actitudes de los estudiantes? Las evaluaciones constituyen un proceso dinámico que pondera los conocimientos, habilidades y actitudes basándose en los resultados del aprendizaje previstos. Estos les permiten a los maestros recopilar datos sobre el progreso de los estudiantes en la adquisición de competencias. Así, las evaluaciones se convierten en una herramienta de control de la calidad y el aprendizaje que hace posible apreciar los conocimientos, habilidades y actitudes de los estudiantes en el contexto del desarrollo de competencias. Pero, ¿qué son las competencias? ¿Qué es una evaluación basada en competencias? ¿Qué herramientas nos permiten evaluar las competencias de los estudiantes? ¿Cómo analizamos los resultados? Estos son tan solo algunos de los interrogantes a los que daremos respuesta en el programa de formación sobre evaluación basada en competencias. Este programa se compone de distintas piezas audiovisuales e interactivas que lo convierten en una experiencia de capacitación única. Estos recursos incluyen módulos interactivos, videos, pantallas interactivas, podcasts, escenarios y casos de estudio, infografías, actividades y muchos recursos más. ¿Estás listo para descubrir todo sobre la evaluación basada en competencias? ¿Qué esperas para inscribirte? Ingresa a la plataforma de la OPS, toma el curso, aprovecha el contenido al máximo y conviértete en un experto en evaluaciones basadas en competencias.
Thank you. Thank you all. We had more than 500 people participating in this very important launch. So I want to thank Andres, Flor, Lorena, Pablo, Marisa, and especially Bremen, the Museo, the advisor on maternal health at Club, and Ana Artigas, who's responsible for communication. And I also want to thank the interpreters that have stayed with us and all the staff that is working for this meeting to be successful. So I thank you a lot for your attention, and we hope to you join the virtual course, and please start talking about it. You already have the recording of the video in YouTube. You can already send it to your WhatsApp group or to your students or to the rest of the teachers that were not present. And the idea is to spread this information. So, and that at the PAHO platform. So at the Latin American Center for Perinatology, we are very grateful for the presence of all of you. Thank you. And please, I'm going to ask all of those of you who have participated to open your cameras, to enable your cameras so that we can say goodbye. Ana, Pablo, Bremen, Marisa, Flor. So let's all say goodbye to the participants at the meeting. Goodbye, everybody.